Heat-related problems occur when a body's normal temperature-reducing mechanisms get overwhelmed and become inefficient or stop working.
Let's take a break. Let's go inside for a minute.
This is especially true during vigorous physical activity. When a person is exposed to warm, humid temperatures, internal body temperature begins to rise. Normally, the person reacts by sweating, which evaporates and pulls heat out and away from the body. Simply rehydrating someone suspected of being dehydrated due to physical exertion and sweating could prevent serious heat-related problems from developing. Drinking a carbohydrate electrolyte drink, such as a sports drink, works well to do this. Use water if a sports drink is not available. Heat exhaustion can occur as a combined result of a rising internal temperature and dehydration.
Hey, are you okay?
No, I'm not doing so good.
Signs include heavy sweating and pale, cool skin. The person can become nauseated and vomit. He may complain of a headache or dizziness and feel weak.
Let me help you, okay?
Yeah, all right.
Okay, let's get you out of here. You may be overheated.
All right.
Although it may not appear serious, treat heat exhaustion quickly. Without early recognition and treatment, it could progress to heat stroke, a life-threatening condition. Have the person stop any activity and move him to a cooler place. Loosen or remove excess clothing. Have the person lie down. If he is uninjured, consider raising his legs 6 to 12 inches. Do not elevate the legs if it causes pain or the person is injured. Spray water on or apply cool, wet cloths to the head and torso. Use a fan to increase the cooling effect. If the person is able to follow simple commands and swallow without trouble, encourage the person to drink fluids, preferably a carbohydrate and electrolyte sports drink. Use water if a sports drink is not available. Do not give anything to drink if shock is suspected, the person is confused, or he has difficulty in swallowing. In most cases, the person's condition will gradually get better. If the person does not improve or seems to get worse, activate EMS.
I called you to check on my neighbor, Mr. Ford. He usually comes to the door right away. I'm really worried about him in this heat.
Okay, I'll check him.
Heat stroke is a condition in which body temperature rises because the body's normal cooling systems are overwhelmed or simply shut down as a result of extended exposure to a hot environment.
Wait right here. Mr. Ford? Mr. Ford?
Heat stroke is a serious medical emergency and can quickly cause permanent damage to the brain.
Mr. Ford, I'm with the sheriff's office. I can help you, okay?
A person with heat stroke will be very warm, even hot to the touch. Heavy sweating could be present, but in many cases the skin can be red and completely dry. Typically, the person will be confused and could have trouble communicating. The person may become unresponsive and could experience a seizure. Activate EMS immediately. The most important action a first aid provider can take is to begin immediate cooling with the resources available. When possible, the best method for cooling is to immerse the person up to the chin in cold water. If immersion is not possible, spray or pour cold water on the person and fan him. Apply cold packs to the neck, groin, and armpits. Cover the person with a cold, wet sheet and continue fanning. Provide continuous cooling until EMS personnel take over care. With early recognition and effective cooling, most people suffering from heat stroke will survive.